Did you know that brutal headaches can be caused exclusively by gluten? Now, gluten is the protein found in three grains: wheat, rye, and barley. Anybody who has celiac disease or gluten sensitivity cannot eat gluten, otherwise symptoms will emerge. So this is a one of about 10 case histories from a paper that was published back in 2001. So let's go through this. So here's this 50-year-old guy who started to develop episodic headaches 4 years ago. So he was 46 when all this started. More recently, the attacks have become more frequent and more severe. So the first thing to appreciate here is that the guy's been eating gluten his whole life, but it didn't emerge in his system. His immune system didn't sufficiently overreact to manifest symptoms until he was 50. That is why this can be so confusing, because you can be eating gluten. So let's just say that you're 0 here age and you're 50, right? And so for all these 50 years, you've been eating gluten, and it was only at age 46 about here did the symptoms start. So it's very difficult for people to go, really, how could pizza be my problem? The gluten in it, because the gluey, gooey pizza dough is because of the gluten in it. You gotta be like, I've been eating pizza since I was a kid. How's it a problem? It wasn't a problem then, because it can take time to manifest. So when it manifested, you can see how severe the manifestation was for this guy. He developed right-sided headache, nausea, confusion, and agitation. Now, there are multiple causes for all of these symptoms. Now, the problem is when they all emerge at once, the odds of having 4 different causes doing all this is ridiculous. So you got to start thinking one major cause, and they describe gluten sensitivity as a multi-headed hydra. Multiple symptoms can emerge that look completely distinct, different, and caused by different issues. Gluten can do them all. So they did a history, no history of migraine, because some of the really weird migraine symptoms, like a hemiplegic migraine, could manifest with some of these symptoms. So the neurological examination was performed, disorientation in time and place. So he wasn't really sure what year it was or where he was, which means you wouldn't really know who the president was. You might be saying, Jimmy Carter's the president, or Ronald Reagan's the president, or Bill Clinton's the president. And of course, he was in England. Actually, this is where this case history was taken, or this case series was done. So he also had gait ataxia, which means he's kind of stumbling along like he's drunk. He also had a visual field problem called right homonymous hemianopia. Now, homonymous hemianopia is also called hemianopsia. This is normal vision. Now, think about this as a really severe visual field defect. You can see you lose half your field. Homonymous hemianopia. So you lose half your vision. This is caused by gluten in some people. I mean, it's so diverse, it's absolutely unbelievable. So again, all of these symptoms, in addition to the painful ones and the disorientation, or rather the nausea and the confusion, as well as all these symptoms. So they did some imaging studies and a couple other tests. So they did some lab work on the cerebrospinal fluid. It was normal. They did visual evoked potentials. They were normal. They did 2 scans, a CAT scan of his brain and an MRI of his brain. Each showed changes. Less signal intensity in this CAT scan and high signal intensity in multiple areas of the brain. I'm going to show you what this looks like in a different case, because it's a really easy one to look at, and I know the anatomy better than this part of the brain on MRs. So they were waiting for a lab test to identify for sure if he had a gluten problem. So what they did is they gave him some pain meds and some anti-puke meds. And he recovered all of his symptoms completely in 24 hours, which means we know for sure it could not be a weird neurological disease, it could not be cancer, and it could not be a stroke. So it has to be something else. So while waiting for the lab reports to come back, he developed intermittent diarrhea and pale stools, which are signs of celiac disease. So they get the lab test back, and it turns out he tested positive for anti-gliadin antibodies. Gliadin is one of the peptides in the gluten protein. Then they did a biopsy of the duodenum, which is the upper part of the small intestine, and it was abnormal, characteristic of celiac disease. And they did a genotype on him, and DQ2 indicates celiac disease. So this guy had celiac disease, and his first symptoms were crazy neurologic symptoms, not the gut. So this guy would have been been diagnosed with atypical celiac disease. Now you can have none of these changes in the gut, have normal biopsy, and still have these symptoms, and that would be called gluten sensitivity. So he went gluten-free. This, as you can see in this case, was published back in 2001, so this patient was 5 years before. His balance improved rapidly, headaches resolved completely. So like the average person out there who says, well, you know, I've been good for 2 years, I miss my pizza, so I'm going to go out and get some pizza, so I eat some gooey, gluey gluten crust, and I start to get similar symptoms again, intermittent headaches, not as bad previously. So they do an assessment on him, and the guy, of course, had bad compliance. He had poor compliance. So they scanned him again, and they showed progression of abnormalities in part of his brain called the thalamus. So now finally he's like, okay, I guess I can never eat again, that crap again, and he has remained free of gluten as of the time of the publishing of this case history back in 2001. So what is the conclusion in this article? Well, first let's look at the title of the article. You see the author, a famous gluten researcher, Haji Vasiliu. Now, he works out of or did back then, out of the Sheffield Neurological Clinic in Sheffield, England. Published in Neurology back in 2001. Look at the title, Headache and Central Nervous System Abnormalities Associated with Gluten Sensitivity. The conclusion is, gluten sensitivity can be primarily and at times exclusively a neurologic disease. And so Haji Vasiliu has published many papers on this topic. Here's another one, gluten sensitivity as a neurological illness. You could even, if you wanted to, you could Google gluten ataxia, which is the gluten incoordinated walking, and you can see many papers on that. Now, for a lot of these people, their symptoms developed like this guy did when he was older, so it took time to manifest, and that can lead to thousands and thousands and thousands of unnecessary testing to deal with all the weird symptoms that gluten can cause. So I told you earlier that I'm going to show you an image that I can better describe compared to all those areas of the cerebral cortex you saw previously. This is much easier, and you'll be able to see too, because we can see almost normal to gluten abnormal. So here's the picture, almost normal. And you can see over here, way abnormally. So you can see, look at the size. So there's been atrophy. Remember how your muscles can atrophy, get smaller and weaker? Well, you can see here, cerebellum getting smaller. And you see all this whiteness you see here? They're called high signal lesions. They're not here. So these are the areas that are being compromised in the cerebellum. So it'll lead to various cerebellar symptoms. In this case, you can see gluten ataxia. You can see cerebellar atrophy. This is a 15-month change that took place. So horrific what can happen to your nervous systems. What other nervous system conditions can manifest? Well, we've already talked about ataxia previously. Peripheral neuropathy, in this case, is typically numbness and tingling. So it can almost mimic multiple sclerosis symptoms for some people. How about this? Seizures, anxiety, depression, headache, dementia. The rest of these conditions below, you'll recognize, some will recognize these, but most of these are not common conditions. These very common, very common. So multiple diverse conditions in the nervous system can occur if you have celiac disease. Now that is, of course, when you have the actual gut lesions. You can also have no gut lesions and have multiple symptoms, like you see right here. So this is from the gluten chapter in my book, The Deflame Diet. And basically the estimate is up to about 6% of the population has gluten sensitivity with no gut changes, just reactions to gluten. So in the US, we got 330 million people. This means up to 20 million people can have a whole host of weird symptoms that they're being treated for without getting any effective results because the cause is gluten. So it's really important to identify whether or not one has gluten sensitivity, and this should be cross-checked with to make sure that your gut is not inflamed, so you're not like bloating after you eat potatoes and those types of things. So in this book, in 2 chapters that go back to back. One is about small intestine bacterial overgrowth. The other one is gluten sensitivity. And in those 2 chapters, I describe the potato test that you can use to, at home, identify if you have gluten sensitivity and then move in the direction to, of course, free yourself of that problem. So if you want to learn more about my take on this, you can check out the Deflame Diet book. You can see the books that I have on Amazon. The most recent one is the Immune Health book. These can be purchased single copies at Amazon, or you can go to deflame.com and you can get volume discounts of any of these books if you want to resell, or give to friends cheap, or give to patients cheap. Give to family and friends cheap, because the volume discounts, you can get up to about half price off all the books for the various volume discounts. So you can also follow me, obviously, on these. Follow us at these various social media sites. So you're right now listening to the video or watching the video, you can click subscribe right there. Head over to Deflame, go right to Facebook, and click follow there, and you can keep you updated there as well. And you can also go right to contact us and become part of the email blast that I have committed myself to sending out more regularly for the remainder of my time doing this. So starting this month, I sent one out last month. I'll be sending out at least one a month, perhaps 2 a month, going forward into 2021. And today, what is today anyway? Today is Saturday, January 2nd. Happy New Year's to you all. My suggestion is to get yourself as deflamed as possible, because this immune problem we currently have going on right now is going to continue probably for the remainder of this year, perhaps even to 2022, if the talking heads in the media are accurate.